And it's time to send it over to Dr. Timothy Quinn, who is with us to talk about COVID-19 and vitamin D. Dr. Quinn, thank you for joining me.
Hey, thank you for having me.
Absolutely. Well, we're trying to learn everything we can about COVID-19. Dr. Quinn, talk to us about vitamin D and how it could lower your risk of COVID-19.
Right. Vitamin D, it's an amazing molecule. We've known for many years that vitamin D has many benefits. It actually boosts and it also modulates our immune system. But there's a lot of research that's going on right now because scientists are trying to find a cure or some treatments for this COVID-19 pandemic. And in a recent study, one that has a lot of buzz right now, there was a conclusion reached that having low vitamin D can result in greater complications and more mortality rates, meaning more people can lose their lives from a COVID-19 infection.
And talk more about the role vitamin D plays in your body.
Yes, most definitely. Now, it has been proven that vitamin D does boost the immune system, and it also modulates the immune system. There's something called a cytochrome storm. And if you get an infection, usually you release cytokines in your bloodstream and it can cause a great deal of inflammation. Well, the research has proven that vitamin D can decrease this, and this can decrease lung complications such as acute respiratory failure, which is one of the #1 reasons people are losing their lives with this COVID-19 infection. So with this vitamin D, if it's at a normal level, you have a stronger immune system and you have less inflammation in your lungs, and it can actually save your life.
And would taking vitamin D help at all?
Well, I just want to note that this study is only observational, meaning it's not conclusive. There's more study that is going on right now to come with a more concrete. It's only observational, but so far it's looking good. And it's looking like if you take vitamin D, you have a better chance. But I do want to add that you can't take too much vitamin D. So we don't want to run off to the supply store and get more supplements. We want to get our vitamin D tested. And you can do this in your doctor's office where they just do a simple blood test and they can let you know your vitamin D level.
Mm-hmm. All right. And kind of talk to me about what's going on with your office right now. Are you seeing more COVID patients lately, or how's it looking for your office?
We are seeing more COVID patients because more testing is going on. We're actually offering the antibody testing right now, which is going to be very beneficial because that'll give us a key as if you already had the COVID-19, because note, a lot of people, and we're talking up to 80% according to the World Health Organization and the CDC, up to 80% of people who have contracted the COVID-19 infection have mild to moderate symptoms, meaning a lot of people had it and didn't know it. So these antibody tests will let us know if we develop immunity so that if we come in contact with COVID-19 again, how much resistance or how much we can fight it off. But there are a lot of exciting things going on right now as far as discoveries, as far as treatments, different information that can help us so we can fight this pandemic and we can come out of this thing just strong and healthy.
Okay, well, good to know. Another place people can go to get that antibody testing. Thank you so much, Dr. Quinn.